You selected D. While there are very useful websites, such as healthcarebluebook.org and fairhealth.org, which help predict the cost of a test or a procedure, these are more helpful when a test or procedure is known about in advance, rather than when the patient is in the emergency center. Insurance companies, similarly, are starting to implement online cost predicting tools. Directing the mom to these resources alone does not adequately address her concerns. You still need to engage in discussion and assist her with understanding why the tests are necessary and which, if any, can wait. You also need to direct her to social work and financial counselors. In reality, the correct answer is C. It is most appropriate to have an open and honest discussion with the mom about why the tests are necessary and which tests are absolutely necessary now, as opposed to those tests which could potentially wait. The other choices were incorrect because they did not utilize a multidisciplinary team-based approach, and they also failed to address the mom's concerns adequately in an open, transparent dialogue. And also remember, you have the resources of financial counselors and social work who are particularly helpful in the acute settings such as the emergency room. And again, let's just review how to discuss costs with families. Remember to be transparent and clear. Avoid using medical jargon that can confuse the families. And be clear and open about your thought process. Share with them the risks and the benefits of the tests and the medications. And you can also call upon and utilize the guidelines to help support your discussion and the points that you are making. And it's always important, just as you did in the case with this mom, to identify her concerns and her worries and to validate them and make them feel real and to provide empathy through that process. And again, we've emphasized this a lot, but using a team-based approach and the resources available to you in your hospital. And remember that families are the most important team members of all. So back to our patient. So you reassess him in the emergency center after giving a normal saline bolus. His oxygen saturation is now consistently 95% while sleeping. He has normal vital signs. So you consult the care guidelines, you recognize that he now meets discharge criteria, so you prescribe amoxicillin and you discharge him home with follow-up with his pediatrician. Before he leaves, you want to prepare the patient's mother for the bill from the emergency room visit. How high is the deductible per family likely to be given that this family has a bronze level plan? A, $1,000, B, $2,500, C, between $2,500 and $5,000, or D, more than $5,000.